We recognise that we play a leading role in ophthalmology in the world, one of the leading hospitals in the world. And with that comes enormous responsibility. You've constantly got to try and do things that are game-changing. And so our scientists, our clinical scientists, our clinicians are incredibly ambitious, and we're glad they're ambitious, and we push them hard. We want the big things that happen that are going to make, that are unique, that are going to change the face of medicine moving forward.
A particular highlight last year was the publication of the results from the London project to Cure Blindness, a Moorfields Eye Hospital and UCL collaboration which restored the sight of the first patients receiving a new treatment derived from stem cell technology.
We also want to do the more simple stuff, the stuff that can actually affect thousands and thousands of people by making small changes. So as I mentioned earlier today in the AGM, as well as the big science things, which we're incredibly proud of, like the London project, we're also really pleased that people like Piers Keane are leading on the work to try and involve artificial intelligence in the way we deliver healthcare. We are growing nurse research and optometry-led research, an area we haven't focused on traditionally as an organisation. But actually we need more people involved in clinical trials, and the way to do that is to engage a much wider and broader workforce. And I think our nurses and our nursing research leadership are doing a tremendous job in driving that forward. Being involved in exciting discoveries, being involved in innovation is an incredibly important part of what we do, but none of that is relevant unless we keep our eye, if you excuse the pun, on the most important thing, which is quality. So the real quality of how we're delivering good care, excellent care, outstanding care to the people who need it most. And about 750,000 people come through our doors in a year. You know, we have a massive challenge on our hands. This is one of the biggest specialties for outpatients in the whole of the NHS, I think second. And yet we consistently do it, and we do it by the fact that we only prioritise our workforce into ophthalmology. We carefully manage our information systems to make sure we're tracking patients properly. And we have a good system, I think, of prioritising and triaging patients throughout that work. But it does come down, like a lot of hospitals, to just hard work. There's no luck in this. It's about people on the ground going the extra mile, and I have to say all of our staff continually do that. And the most important priority of us as a board and all of our staff is to ensure that the quality of care we give to them remains excellent. I've highlighted just 2 examples there of things that we are particularly proud of. Looking at visual stability after macular degeneration injections is the first highlight, where again we're outperforming the national standard. And secondly, looking at successful outcome 12 months after having surgery for corneal cross-linking, where again, we're outperforming the national standard. There are 14 core different sets of standards that we measure ourselves on a quarterly basis. And I'm delighted that during one of our quarters last year, we hit every single standard. So we're either outperforming the national standard or outperforming the global standard. But that's a really important part of what we do.